At the last, ASCO and EHA, we presented really our completed, updated phase 1 data, both in high-risk MDS as well as in acute myeloid leukemia. But in high-risk MDS, again, about 3/4 of patients were responding, over 30% of patients having true complete remissions by IWG, and a survival that was not met at data cutoff with a median follow-up of around 17 months, and over 60% of patients alive with wild type, while around over 16 months in patients with P53 mutant. I think one big question in the field is the depth or the quality of molecular responses. Will that ultimately correlate with overall survival, durability of remission? So we did focus a sequential genetic analysis in this trial to see if we could evaluate which patients molecularly respond and how that correlates with outcomes. So we did sequential whole-exome sequencing, which I think the benefit is, of course, you're really broadly sequencing a very high number of genes. I think the negative is the sensitivity. So the sensitivity of this assay is around 7%. So you can get deeper both with traditional and sort of next-gen sequencing, such as molecular barcode or error-corrected. But if we focus on the P53 group, actually all of our patients in the MDS cohort who achieved complete remission had molecular clearance. And we and others have showed that patients that achieve this clearance really ultimately translate to the best outcomes, particularly in patients that go to transplant, where molecular clearance may be the most important biomarker for patients that ultimately have benefit. We did additionally see other molecular subsets, such as RAS mutations having clearance, and then maybe molecular subsets that we would not think clear, such as mutations in clonal hematopoiesis genes. So I think, the long story short, we do see a high concordance of molecular clearance, particularly with P53 mutant patients that achieve complete remission. And looking forward to, I think the next steps will be much higher depth sequencing, ideally to be done in the phase 3 setting.